I'm Kathy Lopresti. I'm a member of the Board of Directors of the Benjamin Rose Institute. And on behalf of the board, I want to welcome each of you here today for our Katz Policy Institute lecture. This is our first Katz Policy Institute lecture was in 2007. And this lecture was named in honor of Dr. Sidney Katz, a distinguished scholar on our staff for over 20 years. And I must say, the subject matter is certainly of interest and very timely for obvious reasons. So on behalf of the board, I want to thank you for being here, and I hope that you will find this beneficial time, both in listening to Director Plouck and in networking with others who are here. Welcome.
Hi, I'm Linda Nolker. I'm the director of the Katz Policy Institute, and I just want to mention that this is the first year in the 5 years we've been doing this that Dr. Katz hasn't been able to be here. He and his wife have relocated to Michigan, but he always took great pleasure in these events and speaking with the individuals who are delivering the lecture in his name. So we will miss him, but I know that his thoughts are with us. So with that, we have the perfect segue to our speaker, and it's with great enthusiasm that I introduce her as the 2011 Katz Policy Lecturer. She's been the director of the Ohio Department of Mental Health since last January. There's a little blurb about her in your program. So as you look at it, you can see she's had an extensive history in the public service sector and in public policy. I've heard Director Plouck speak before, always offers very insightful information about mental health services, and we're very eager to hear her remarks about the department's goals and their strategies for improving mental health services and how the state budget and the Office of Health Transformation is going to impact these goals and these strategies. So without further ado, I welcome Director Plouck to the podium. I hope you give her a warm welcome.
I'm very pleased to be here today. I'm approaching my 17th year in state government, and I've served in a variety of roles, but I've sort of meandered through the human services system at the state level. And so I know from firsthand experience that the Benjamin Rose Institute has been very involved in public policy discussions down in Columbus over quite a long time. Specifically talking about rebalancing the system between institutional care and community-based services. And I was teasing Rich Brody when I found out he wasn't going to be here tonight that he probably skipped town when he found out I was presenting. So many of you may be aware of these stats, but I just wanted to share to set the stage. We serve several 100,000 people through the public sector. This is a combination of state dollars and dollars that are locally generated throughout Ohio's communities. We have 50 local mental health boards. There are 3 freestanding alcohol and drug boards, but in most communities like Cuyahoga, they're combined boards. Hundreds of providers. We have 6 regional hospitals, and we have a pretty significant budget, over $1 billion, and then there are additionally $330 million of local resources that are generated to support services throughout the state. So we've always had always, like since the late 60s, a behavioral health system that was freestanding and has rendered a lot of benefits, but there's not been a lot of very direct integration in most places with physical health. And I attended the All Ohio Institute for Psychiatry here in, I think it was in Pepper Pike or in Beechwood, about 6 months ago, and there was a presenter there who talked about the invention of the neck, and I thought that was really a good way to put it. We have diseases of the brain and diseases of the rest of the body, but oftentimes we deal with them completely separate instead of looking at the comprehensive individual and what it is that they need in order to be well. So in that context, when the administration changed in January, Governor Kasich created the Office of Health Transformation. And just to tell you a few seconds worth of information about this, it is very a small staff. I think there's 3 or 4 folks, but really the power of this comes from the state agencies that deal with health and human services issues. So mental health, developmental disabilities, health, aging, job and family services, which is the single state Medicaid agency, and alcohol and drug addiction services. And we have a work plan that includes different things, how we're paying nursing facilities as an example, or how to integrate physical and behavioral health care, different information technology initiatives where we are going to be able to share data across the different systems better and differently in the future. One key theme, though, is how we can take behavioral health and pull it into the rest of healthcare in a way that is more meaningful for the people who are receiving services. And health transformation focuses on what is being called as hotspots. Where are we spending the most money and seeing the least quality in terms of outcomes? And oftentimes this has to do with folks with both physical and behavioral health challenges. So just to really highlight this is a slide that we used during the budget. Ohio has between 1.1 and 1.2 million Medicaid enrollees. 10% of those have a diagnosis that is related to severe and persistent mental illness. Those people, that 10%, or about 210,000 folks, account for 26% of all of Ohio's Medicaid spending. So clearly, this is not just behavioral health, but it's also their physical health expenditures. And so if we have an opportunity to change policies and engage folks differently at the provider level, this is an opportunity to not necessarily decrease spending, but decrease the growth of spending over time. And in so doing, connect with people at the primary care point so that hopefully some of the chronic care conditions can be avoided or minimized a little bit further down the road.